Welcome to everyone who has joined us already. It's now 4 o'clock, so I'm looking forward to beginning the webinar very shortly. I'm going to do a brief introduction of myself as we wait for a few more people to join, and hopefully everyone's had their Zoom update done correctly. I know that that's caught more than a few people off guard. So first of all, just to say welcome and please settle in. We have a really exciting program for you that we will be starting in just a second. All right, hello and welcome everyone. This is the second webinar that we are hosting here via the KPSRL. Today's webinar is going to be on securing public trust and social cohesion during the COVID-19 pandemic. And we are very excited to be joined by our Mercy Corps colleagues who have been specifically focusing on this element of this aspect of the pandemic that we are all experiencing. If I can start by introducing myself, my name is Megan Price. I am the head of office at the Knowledge Platform for Security and Rule of Law. And I am a growing and learning online moderator at the moment. And we are very excited to be able to transition into this online format. It's posed challenges, but also opportunities. One of those major opportunities being that it's allowed us to include new people into events from across oceans and mountains that typically would be inhibitive and not allow us to create an event that's so inclusive as we can now. So why are we hosting webinars? Actually, I mean, for the obvious reason that that's the only way to meet at the moment. But at the Knowledge Platform, we've always prided ourselves in being able to create spaces of trust for candid conversations that we feel are so necessary in our field. So we are trying to recreate that, and we find that the webinar format allows people to receive information that can be trusted. It's delivered by experts. It's delivered in a way where people are seeing who the source of information is. And it's allowing us to continue with our general effort to share knowledge and encourage learning within our field. More to the point, we'd also very much like to encourage our community, that's everyone here in the audience and among the panelists. All of you, we'd like to encourage you to continue to contribute your skills, your knowledge, to continue to help us set the agenda. So if you have ideas for webinars that would be great to host in the future, please come forward to us, write us an email. We'd be excited to talk through what other ideas there might be out there in our community that we can feature. So today we have two peacebuilding experts from Mercy Corps, and they'll be here to discuss how the pandemic is exacerbating existing threats to social cohesion in fragile conflicts, and how the international response can be made more effective in preventing violent conflict. I want to take a beat here, though, because one of the reasons that I think we kind of need to acknowledge, this is such a salient topic, not only for our partners working in or living in fragile and conflict-affected settings. We feel very, very sharply and acutely how important public information, public trust is. We see it disintegrating in many, many spheres. So what we learned today obviously is really important for our professional careers, but I think we can all acknowledge that regardless of whether you're living in New York or Bujumbura, or if you're working in London or Lagos, this is a topic that is incredibly important. So I think, you know, with that, it would be best to kind of take that on in not just a professional way. Allow yourselves to recognize the salience of this in every aspect. Today we're going to talk about raising the awareness of how the pandemic is affecting public trust and social cohesion. We're going to share good practices for countering misinformation and for strengthening community engagement. And we're also going to hear experiences from you among us in the audience who are our broader community. So I would like to make sure that we have an active discussion at the end of this conversation. With that, I'd like to put down some house rules. First of all, I hope you notice the session is being recorded. That means that we will be able to upload it publicly in the future and make sure that other people who aren't able to attend at this moment can still benefit from the speakers' presentations. It also means, however, that if you wish to ask a question in the latter part of the program, and if you wish to do that directly with your own voice, you are enabled to do so, but please be aware that your name and your voice will be captured in the recording. If that's not something you're comfortable with, there is another option to write your question and you will remain anonymous that way. Either way are perfectly fine. A second thing that we'd like to try for this particular session that we haven't done in the past is to enable the chat. So you see that below it there's a chat. We've heard in the past that people feel more comfortable if they know who else is in the room. So I'd like now to invite all the participants to simply write your name and your organization in the chat, or maybe just give a brief hello when your name appears. That allows everyone to see who else is here. It helps to create that trusted community, that trusted atmosphere that we were speaking about before. And so I would very much encourage everyone who is watching this as an attendee to go ahead and identify yourself in the chat. Please know that the chat is not recorded. The chat will not be made public. It will not be recorded or featured in any public contributions or in any public iterations of this. All right. So while that is happening, I'd like now to briefly take the opportunity to introduce our speakers. Both are from Mercy Corps. We will have our first intervention from Emma Whitaker, who is the Peace and Conflict Advisor. And Emma, I'd invite you now to activate your video and your microphone and go ahead and introduce yourself.
Hey everybody, it's nice to be here with you. And thanks to KPSRL for inviting us to be here. My name is Emma Whitaker, and I'm the Peace and Conflict Advisor for Mercy Corps globally, based in London, and had previously been based in Central Africa. I work on a number of different themes, and happy to present our work on COVID and misinformation and social cohesion.
Great, thanks very much, Emma. Emma's presentation will be followed by Danjuma Dawop, who is the head of conflict management and social cohesion. He typically works in the Iraq office, but is currently based in Nigeria. Danjuma, I invite you now to open up your microphone and video and introduce yourself.
Hello, everyone. It's taking some time. Sorry, I shouldn't have unmuted my video. Good. Hello, everyone. Good evening from Nigeria. My name is Danjuma Dawop. I'm the head of conflict management and social cohesion with Mercy Corps Iraq. I came into Iraq a year ago. I came in from Nigeria while working in the farmer-pastoral conflict in Nigeria, especially in the Middle Belt. Prior to that, I also worked in Syria, Northeast Syria, working on peace building and social cohesion. Thank you.
Excellent. Thank you very much, Danjuma. With that, just to let our participants know, I will go into more detail about how to ask a question at the end of the presentations. We're going to have a brief presentation, like I said, first from Emma, and then we will turn to Danjuma, and then we will have roughly about 15 minutes for questions. So with that, Emma, I invite you to begin your presentation. We're looking forward to it.
Great. Thanks so much, Megan. Okay, I'm going to stop my video and share my screen so that everybody can see the presentation. Here we go. Megan, can you see that screen?
Yes, we can.
I can. You're looking
Perfect. Great. All right. So Mercy Corps is a multidisciplinary development and humanitarian organization. We work across a range of sectors, including economic development, governance, agriculture, and environmental management, among many others. And we care about a range of outcomes, including poverty alleviation, food security, environmental sustainability, and peace. We operate in some of the world's most complex and fragile environments, including 17 of the 20 countries ranked lowest in the 2018 Global Peace Index. Our 5,500 plus team members live and work in more than 40 countries around the world. 87% of them are from the countries in which they work. Our peace and conflict work specifically seeks to reduce and prevent conflict through explicit peacebuilding activities and to build the foundations for sustainable peace through humanitarian and development programming. Based on past lessons learned and trends we were seeing globally, Mercy Corps developed a 4-pillar international strategy to respond to COVID-19. And today in particular, we're going to be looking at that 4th pillar, which is expanded access to trusted, reliable information sources. So we're seeing COVID-19 as a slow onset crisis, impacting every system we work in. Beyond just the immediate health implications, we're seeing secondary and tertiary impacts. While it's likely too early to tell how the disease's spread will differentiate across different countries, one thing is certain: the world's fragile states, where the social contract between citizens and the state is severed or weak, are likely to be hardest hit, and that could pose a significant risk to the global pandemic response. So on this slide, I've highlighted a few of the key trends related to conflict COVID triggers that we've seen throughout our country offices.
Emma, may I just a second?
Yep.
We are able to see both your notes in the next slide. So I don't know if you want to present in a different way.
Oh my goodness.
It's not too distracting, but I just wanted to make sure you were aware of that.
Thank you. I don't know how to do that. Let's see, sorry, a second. I don't know how to change that.
Well, that's okay. Sorry to interrupt. I just thought
no, it's okay.
Be aware. But please just go ahead. It's
Is that better?
Yes, you have
Great.
it.
Okay, thank you. So, as I said on this slide, and now that you know the mystery of what's coming on this slide, are a few key trends related to COVID conflict triggers that we've seen throughout all of our country offices. So we have things like economic strains, perceptions of aid delivery, pre-existing limited humanitarian access, political exploitation, and above all, the spread of misinformation. So here we're talking about rumors around the origins, spread, and treatment of COVID-19 that have resulted in violent events in several contexts. So first, to take a step back, we'll look briefly at how information, and especially social media, can be weaponized and pathways can be developed to create real-world offline harm. So social media has emerged as a powerful tool for communication, connection, community, and unfortunately, conflict. It's created new, highly accessible channels for spreading disinformation, sowing divisiveness, and contributing to real-world harm in the form of violence, persecution, and exploitation. The impact social media has had on real-world communities is complex and rapidly evolving. It stretches across international borders and challenges traditional humanitarian aid, development, and peacebuilding models. Disinformation or hate speech and recruitment to violent groups through social manipulation is not a new phenomenon. These activities have long been identified as drivers or triggers of conflict and a focus of violence prevention efforts. In the past, these activities happened through traditional media and in-person communication. Social media has changed the game, however, and here's how. The social media platforms increase communication power. The international reach and the ease of access to social media means that a higher volume of weaponized information can reach more people and faster and via multiple channels. The personalization of social media targets individuals and amplifies impact. The social media platforms tailor information to individual users' preferences. Machine learning takes that personalization further, serving up more targeted content and narrowing the scope of information an individual receives to topics and viewpoints that confirm and reinforce one another. The next is through the personalization, which increases polarization and exacerbates conflict risk. Social media platforms organize users into groups that share preferences and demographic characteristics, creating bubbles or echo chambers that align with ethical, ideological, linguistic, or other societal divisions. Rumors can seem like credible facts, and collective online outrage can quickly trigger real-world violence. And so the last way that we see how social media has changed things is to the weaponized information, is that weaponized information is difficult to police. So online conversations and offline actions that flow from them can evolve quickly, and it can be nearly impossible to identify individual wrongdoers among the billions of social media users. Because the same qualities that make social media prone to weaponization also makes it a powerful driver of positive engagement, and regulations that technology companies have struggled to isolate and keep pace with the threats that are emerging. So this new paradigm requires a new approach, and with the advent of COVID-19 has made the development of response model even more urgent. So just to briefly go through a couple of types of digital harm, because we often hear about misinformation, but maybe don't know the distinctions between misinformation, disinformation, etc. For misinformation is incorrect information spread by people without the intent to deceive. And this is different from disinformation, which is incorrect information spread by people intentionally in order to deceive or manipulate others. Whereas hate speech, which we've seen less of as a primary trend related to COVID, but it is nonetheless worth highlighting, is any form of expression, such as speech or text or images, which demeans or attacks a person or people as members of a group with shared characteristics such as race, gender, religion, sexual orientation, or disability. And dangerous speech, finally, is speech that has a special capacity to catalyze or amplify violence by one group against another. So the COVID-19 pandemic presents heightened risk for societies with low levels of social cohesion and a lack of trust between citizens and states. The accompanying infodemic makes matters worse by spreading harmful information that not only undermines health responses, but it also tears at the social fabric. In addition, pre-existing suspicion of health authorities and aid actors in many countries adds to the danger, as exemplified by the recent destruction of a COVID-19 testing center by demonstrators that we saw in Côte d'Ivoire. All of these factors drastically increase the likelihood of violence, witnessed already in surging numbers within the household level, and widely feared and predicted to come at the community level. So Mercy Corps has been producing a regular secondary impact analysis report through field-driven analysis to identify emerging trends relevant to operational decision-making. On your screen, you can see an example of the title page of that, a recent report, or actually that's from April. As an example, in the Central African Republic and the Democratic Republic of Congo, those are two countries where anti-foreigner national resentment is being most explicitly demonstrated, which is fueled by a positive COVID-19 diagnosis from an INGO staff. And anecdotal reports suggest that many street newspapers across the region are now running sensational stories, such as ones we see from South Sudan. I think it's coming on the next slide. Oh, there we go. So that's that foreigner first coronavirus case in Juba is the example of a street newspaper from South Sudan that's continuing the spread of misinformation. So misinformation is not only a cause of problems in the response or in social cohesion, but it is also a symptom of a deeper division in society. Solutions to address it must therefore come not only from countering misinformation, but also from addressing the root causes of that division. As an example, levels of division rather than levels of development may be a stronger determinant of effectiveness of a response or spread of harmful information. The weaponization of social media, or the weaponization of information, produces digital and offline proximate drivers of conflict or triggers with a distinct causal relationship and the potential to influence more people across broader geographies and with immediate impact. These drivers are relatively short-term catalysts that accentuate a conflict's underlying causes and promotes the escalation of violence. social media weaponization in particular acts as an amplifier, speeding up or increasing the potential for conflict beyond what traditional media forms have the power to do. So social media fills the trust gap and intensifies rumor dynamics. The conflict-driving effect of personalized information is exacerbated by the low levels of trust that are prevalent in settings with histories of violent conflict. Low intergroup trust is more commonly found when groups have a history of competition or violence. Low trust in institutions is linked to a history of state governance failures, and particularly relevant to the weaponization of social media when independent media has been restricted by the state, which we've seen in a number of contexts since the COVID pandemic. When these types of trust are low, and when alternative sources of verifiable truth are less readily available, people tend to rely upon and believe in information that is provided to them on social media who share friendship, kinship, ethnic, or religious social ties. So Mercy Corps' own experience working on the Ebola epidemics in West Africa and the Democratic Republic of Congo has shown us that ensuring a constructive exchange of information and healthy collaboration between communities, authorities, and responders can play a crucial role in enabling an effective response and preventing violence. For example, in Liberia, we supported community mobilization campaigns that reached over half the country and established two-way flows of information between communities and responders that led to an increase in acceptance of healthcare workers from 15 to 68%. From our experience in responding to Ebola, there are a couple of key lessons that can be adapted for the current COVID-19 response. The first is a strong focus on community engagement and community mobilization, which must be prioritized across global response efforts. Secondly, is effective coordination is another key dynamic. Coordinated response and a clear information sharing among NGO, UN agencies, and government institutions is essential in any response, but especially during an epidemic, where a fast and effective response is necessary to stop transmission. And finally, to focus on limiting the economic impact. So response and recovery efforts should sequence and layer short-run market-based relief with longer-run interventions that address economic constraints and drivers of conflict and distrust fueled by COVID-19. So what we are working on. So we're focusing on the need to continuously address the root causes of division, as the response to a crisis can shape views and practices for a long time in a given context. To prevent conflict from escalating into violence, we increase social cohesion by building, or sometimes rebuilding, relationships between conflicting groups, whether between ethno-religious political groups or communities and the government. We create opportunities for cooperation over shared interests, such as natural resources or basic service provision and economic development. With cohesive relationships, people are better able to ensure that rumors, misunderstandings, and smaller disputes do not escalate into violence. Our global COVID-19 response strategy includes all of these components, and we already are adapting programs from Uganda, Haiti, Myanmar, Liberia, and soon you'll hear more about from Iraq. We're doing that by leveraging our networks of civil society partners and community-based organizations to commence two-way communications, both online and offline. We're also providing conflict sensitivity guidance for field teams working on COVID-19 responses, including both adapting existing programming as well as creating new programming to trends emerging in various contexts. And finally, we're engaging with local communities and authorities to advocate for community members to be able to help and take the lead in responding to the virus. So what you're seeing on your screen here on the right-hand side is Mercy Corps' response framework, in particular to the weaponization of social media. So on the left, the text is more about general on COVID, and on the right is more particular to digital information. And that focuses on 4 key areas, that including the prevention of the impacts of the weaponization of social media, monitoring and detecting and assessing threats, and those are happening at the global level, where at the local level, we try and work on mitigating the impacts of the spread of misinformation or disinformation. And as well, we're trying to build resilience so that communities have the resources available to face the spread or misinformation that they might be receiving, especially in a context like the COVID pandemic. So with that, I will hand it over, I guess, to Danjuma, who can now provide us more details from the Iraq context, or maybe I hand it back to you, Megan.
No, that's fine. Thank you very much, Emma. It was a rich explanation of the way in which Mercy Corps specifically is tackling the dilemma, not only in this particular COVID context, but more broadly around the weaponization of digital media. With that, yes, now I am excited to invite Danjuma to the floor to talk more specifically about his experience in Iraq. So Danjuma, please go ahead.
Yeah, thank you so much, Emma, for that wonderful presentation. As Emma had mentioned, Mercy Corps works in a lot of countries, building peace and social cohesion. In Iraq, we've been working since 2003, working with community, especially community leaders, women and youth, in identifying and resolving disputes and conflict around religion, ethnicity, also resource-based conflict around water and land. Through our work, we've been able to identify and observe how COVID-19 had magnified some of these existing social cohesion challenges in the communities in which we work. As we speak, there are about 6,868 confirmed cases of COVID and 215 fatalities. Today, I've been asked to talk about COVID related to misinformation, trends, and public trust in Iraq. Now, before I do that, I think it is also important to understand some of the underlying tensions and root causes of social grievances in Iraq. That way, we'll be able to understand how these unaddressed issues are sitting, bubbling underneath and ready to erupt. As we know, Iraq is a very dynamic country with a lot of religions and ethnic groups and tribal groups. Iraq was also affected by ISIS. ISIS attacked the country and a lot of people were killed. There was brutal mass killing, which had led to a lot of configuration in terms of communities. Social grievances within communities are still existing before ISIS, and they continue during ISIS, and they're existing now. Now with COVID, it kind of magnified these existing tensions and fractured relationships within communities. One of the things that I want to highlight is the fact that in terms of the impact of COVID, I'm going to focus on 3 levels. One, the level at which COVID impacts on communities. The second one, I'm going to talk about COVID, how it impacted about the relationship between communities and government. And the third one is toward religious leaders. I think it's very important to understand that with COVID, it had manifested in a situation whereby communities are informed through fake news, through conspiracy theories, through disinformation, rather than articulated information, either from government or from other sources that they can trust. And because of that, communities tend to make up their own mind about what the real issue is. And this has led to a lot of tensions happening in communities in which we work. For instance, number one, tensions and division within communities. If you remember, the first index for COVID in Iraq came through people who had traveled to Iran, which shares the border with Iraq. These people that came in are either students, traders, or people who went on pilgrimage. And so now people believe that the reason why there are, and when we say people, the other religious sect, which is the Sunni, believed that the people who came in with the virus to Iraq, meaning the Shia sect, are the ones to be blamed for the spread of the virus. And so you discover that within communities themselves, you find out that these communities, if people tend to travel out, there's suspicion when they come back. For instance, we have a recent example where Shia sect traveled for a ziyara, which is like a religious visit, came back to their communities, and the communities refused to allow them to sell their dairy products in the market. And the reason being that, one, they might have traveled down to the south of Iraq where there's prevalence of the virus, so there's this possibility that they are infected, and so they'll infect the community. So we have that happening. We also have a situation whereby in all these communities that are happening, our team members, our colleagues who had lived through the period of upheaval in Iraq, the period of violent conflict in Iraq, actually make a comment to say, we are seeing something similar to something that happened in 2006, which had led to a violent and inter-violent conflict between the two major religious groups, the Shia and the Sunni sect in Iraq. So they are seeing these early warning signs because exactly what happened in 2006 is almost the same thing happening now with each of these religious sects blaming each other for the spread of the virus, blaming each other for infecting other people. So this is happening now, just like it happened in 2006. Now, the second thing I also want to talk about is government. Now, prior to COVID, the government has been grappling with trust issues among the Iraqi people. For instance, there had been a massive protest that started in October 2019 over unemployment, corruption, and so on and so forth. Now, because of this, when government issue out information, people don't believe that. People believe that government is using the epidemic for several reasons. One, people believe that the government, Roman number one, for instance, is that there's no virus. Government is just creating it just because they want to crush the protest that has been ongoing. Secondly, people believe that government are using the virus to prevent them from practicing their religion. Thirdly, and which is the most important, is that government has created this information about virus so that they will use the money or steal the money that will be meant for emergency response or disaster and emergency response. Rumor number two. Now, after the initial announcement that, oh, there is the virus, government said, okay, we are going to provide palliative. We are going to provide financial support to people so that we will cushion the effect. Government didn't do anything again. Nobody knows what government did. Now there's fake news going around that government is planning to give each person that is infected with the virus 8 million Iraqi dinar, which is equivalent to 6,700 American dollars. Now this has pit people against each other, communities against each other, especially across tribal and religious lines. In each community, tribal, religious, and ethnic groups are accusing one another of faking the infection so that they will collect this money. Now, in terms of the management of the virus, a lot of criticism is coming against the government on how they are managing the crisis. In fact, at the beginning of the crisis, people have started complaining that government did not put in mitigation measures that will arrest the spread of virus, especially with regards to airports. There are a lot of people who are saying that government allowed a lot of people to pass through the airport without being checked, thereby people coming in to infect other people. We also have the issue of WASTA. WASTA is kind of a system whereby what it simply means is that you having friends in high places or knowing people in high places. So there is a lot of issues happening in Baghdad at the moment. That the fact that one of the nephews of the Minister of Industry, who was quarantined because he was suspected to have the infection, decided to leave before the 14 days quarantine because of his connection. Now, people are very angry because after he left, there were rumors that he had gone to attend events where there are a lot of people. Now that it has been announced that he is positive, and so people are very, very angry. Now, in terms of religion, you discover that even during the protest, we have a lot of influential religious leaders in Iran. Within those two religious sects, both Shia and Sunni. These religious leaders are very, very powerful. They were they are among those who were considered to have influenced the way the protest was ongoing. Now, these same leaders are using the same way that they were able to influence the protest, using social media like Twitter, WhatsApp, Facebook, and video. In fact, there was a video that was circulated by one of these high-profile religious leaders saying that the virus cannot infect Muslims. And a lot of people believe them. Now, all these are really, really happening. And you discover that people, even within the communities in which they live, they have known each other. But because of this division, they tend to mistrust each other in terms of not knowing whether this person is infected, or this person is hiding his status, or this person is doing engaging in some of these activities that could have made him infected by this. Lastly, I think one of the things that we also need to understand is the fact that a lot of mosques and a lot of worshiping centers were closed. Iraq have a lot of sentiments toward their religion. So because of this, when the churches and the mosques were closed, people were protesting. They were protesting not because they were not allowed to pray, but they were protesting that the worshiping centers were closed, but borders were open for allowing foreigners, especially INGOs workers, expatriates coming into the country to enter into their communities. So all these are happening. I'm sorry I seem to have painted a very bleak picture about what is going on in Iraq, but not everything is gloom and is gloom. We have communities coming together, just like other people, coming together to support each other within their communities. For instance, Mercy Corps, prior to COVID, has set up what we call community action groups. These community action groups are responsible for identifying issues within their community and also escalating those issues to the higher level, either at district or sub-district level. Within those community action groups, we have youth groups. Now, these youth groups voluntarily, seeing that government is not doing enough to educate people about the COVID, have taken upon themselves to carry out awareness raising and sensitization campaigns in their communities, providing accurate information, providing also some tips around social distancing, hand washing, and other mitigation measures. We also have community leaders that we train that were supposed to be identifying or resolving disputes around either ethnic, religion, or tribal, including resource-based disputes. These community leaders have actually stepped up and also identified COVID-related disputes that are as a result of misinformation, as a result of fake news, and they have been very, very active identifying and resolving this. Lastly, we also have local peace and development committees. This is the umbrella body where you have all the community representatives, either through ethnic, religious, tribal, women, youth, coming together to work together for the benefit of their community, specifically identifying issues that affect the communities and also mobilizing communities for the common good. Now, these also groups are also going around identifying those people who can afford to donate some food items or money, and they buy and distribute it. And so these are some of the few examples that I can give about what Mercy Corps has been doing to ensure that we are mitigating the impact of misinformation with regards to COVID.
Thank you,
Juma.
I was just going to say, we're going to need to take some time for questions. Do you have one final closing remark?
Yes, please. So finally, I think I will want to call upon the global community to ensure that we include marginalized groups, women, especially women, youth, and people with disabilities, in terms of providing them with adequate information. I feel that there is need for increased support to civil society groups to be able to, in terms of capacity building, also support training for government. And lastly, I will want to call upon the large social media platforms such as Twitter and Facebook to ensure stronger regulations and do no harm policies as this COVID ravaged the communities in which we work in Iraq. Thank you very much.
Thank you, Danjuma. That was a very rich, lots of examples, as you yourself mentioned, not always the most cheerful examples. There's a lot of challenges out there to be aware of. So thank you very much for sharing those. They were, they were quite specific. I think what both Emma and Danjuma's presentations are really speaking to is that there's not necessarily perhaps a new phenomena of social mistrust or public mistrust. It's simply that the COVID-19 pandemic seems to be capitalizing on fissures that are already existing in communities, and all the more reason for those who are working within security and rule of law to be attentive to how groups who had been marginalized or who were self-segregating might become all the more kind of captured within their echo chambers, might become all the more kind of subject to vulnerabilities about misinformation as they pull back into those trusted communities. So it's very important to realize the many ways in which information needs to be shared and coordinated across all the different groups and social divisions that might currently be existing. So I thank you both very much for these reflections. I find them really useful in this moment. I'm now going to open up the conversation to the rest of our group. I want to simply lay down a couple of ground rules. First of all, I would like to say that there are two options for being able to submit a question. First of all, you may raise your hand, and I see that we do already have a raised hand, so that's great. And secondly, I want to also I want to iterate that if you raise your hand and you want to take the opportunity to ask a question out loud directly to our speakers, that's great. We really like it. It helps to create a more community atmosphere, but please be aware that your voice and your name will be captured in the recording. If for whatever reason you prefer to write your question, please use the Q&A form at the bottom of your screen, because that will allow us to kind of keep track of the questions as they come in. You can do so anonymously, you can do so with your name, either way. Melissa, our colleague, will be reading those questions aloud. She will also be the one who is monitoring who has raised their hand. So, Melissa, I'm going to hand over to you to start the moderation of the Q&A session. Once again, you can raise your hand and Melissa will call on you. Once you've been called upon, you can unmute yourself and speak your question aloud. Please keep your question concise. Otherwise, you can enter a question into the Q&A form. Also, if you see a question that you like, that somebody else has submitted, you can upvote that question so that question gets kind of raised up on the list. Please do not submit your question in the chat. The chat is not going to be monitored for questions. So please don't make that mistake. Please submit your question via the two forms that I just spoke about. From there, Melissa, why don't you go ahead and take it from there?
Thanks, Megan, for the introduction. So Megan's already given very clear instructions on what to do, so I won't have to reiterate anything. But in case you are looking for the Q&A box, to the bottom of your screen on the right, and it says Q&A. I see Elias Changa from Lusaka is already raising his hand, so I'm going to unmute you, and you can feel free to use your own voice to ask your question to our panelists. Go ahead, Elias. Elias, are you able to unmute yourself? It's on the left side of your bottom of your screen. I'm not sure if you intended to raise your hand. But if not, other people can also fire away their questions by typing it in the Q&A box. All right, I'm going to assume that was an accident then. Just going to see if anyone else has their hand raised. So we did have one question, and the person did not indicate their name, so I will just be reading from it anonymously. Who I think this question is for you, Danjuma, asking, what are the specific experiences that women are facing during COVID-19 in Iraq? Don't forget to unmute yourself, Danjuma.
Thank you very much. In Iraq, really, because one, as you know, due to the restrictions, especially with regards to lockdown, families are forced to stay for a long period of time together. This has not happened for a very, very, very long time. And so a lot of issues around gender-based violence are being reported, especially in the southern part of Iraq, where the people are a little bit conservative. And so it's so difficult for women to actually either express themselves as they used to, because now that their husbands, their children, and everybody is in the same house. So women, even when they want to complain, now they can't. One of the issues that I also want to highlight about the impact of this on women is the fact that those who are infected are more marginalized than are stigmatized. For one, they are stigmatized. Two, they are considered to be, there is a God's punishment on them because they are one way or the other. There are places where they say, oh, any woman that is infected is because she's been misbehaving to her husband or because she's misbehaving to her clan or anything. Another way is that, again, when they get infected, they're going to go for quarantine or they can't go for self-isolation. They had to live within those communities, live within the, so there's also this likelihood that they might infect those people within their. So women tend to not even reveal whether they are sick, whether they feel they have the infection. So this has a very negative impact on them.
Thank you, Danjuma. We have another question. And once again, if you're typing your question, I'm going to assume you don't want your name read aloud. So this question might be for either Danjuma or Emma. What have you found to be the most effective media type to challenge mis- and disinformation?
I think I'll allow Emma to answer that because she's the expert on this.
Thanks. That's a really good question. I think in terms of media types, good question. I think one of the opportunities that sort of works best, depending on context that we've seen, is radio messaging. It's a really good opportunity to engage with communities and have communities' voices sort of verify information and be a constant source of communication. I think rather than platform, we look more about the two-way communication channels. So for example, are communities able to speak with other communities? Are they able to share their own information? Are those channels being connected with government actors? And in the context of a sort of response like COVID, are they able to be connected to international or national NGOs or civil society organizations? I think the sort of media platform that is most effective depends on the sort of digital penetration in a certain context. So it could be like SMS text messages, something like a push notification or an early warning system, or in other contexts, it could be monitoring Facebook sharing and posts. So I think it's really context dependent, but I would say that the core element is understanding that there's sort of two-way channels and in any of that platform.
And in fact, in Mexico, Iraq, we have actually repurposed one of our activities working with youth because we know there's a lot of usage of social media, especially Facebook and WhatsApp. So we are working with youth, providing them with adequate information so that they reach out to youth like themselves to actually counter all this misinformation, conspiracy theories, and fake news.
Thank you, both Emma and Danjuma. Earlier, our hand raiser was unable to unmute, but he's typed his question. His question is about the rumors that the testing kits of COVID-19 are not accurate. Even people with no symptoms are tested positive. Is there anything that you can say about this?
Yes, in fact, we have an example in Salahadin whereby people who traveled came back and they were tested in Iraq, in Baghdad, and they were tested to be negative. They went back, they went down to Salahadin in Tikrit, and they were tested again, and then they were found to be positive. And so they were really, really angry and were saying that the government testing procedure are not right. People they're just doing anything anyhow they want to do. And so it's also creating tensions within people who have been tested and found positive, who now kind of dispute that and said, no. We have examples where some people were tested negative and then they found out to be positive. We also found out that there are people who are tested positive and we found out they are negative. So this is also actually happening in Iraq, especially in Salahadin.
Thanks, Danjuma. I guess I'll just add from a more global sort of thinking. I think this is a really good example of why COVID is so complicated, because there are so many different pieces of information, so much uncertainty around the disease itself. And I'm in no way a health expert, but what I think, what I've read so far in multiple sources is that you can still be positive for COVID-19 and be non-symptomatic. So I think, while I can't really respond to the specifics of the health implications of your question, I think what this presents us is an opportunity to talk about sort of information sources and reliable opportunities for triangulating that information. Are your sources trusted? Are you able to trust them? If not, how does one or a community member find trusted information sources? Because if this is the sort of, let's say, a rumor or a question that gets circulated, how do we control the spread of that question so that people don't, like as Danjuma just said, get angry for different types of testing, and over time, testing can change. So I think what I would refer back to is sort of our Mercy Corps' approach about understanding sort of how to create media literacy and resilience in communities about understanding what information is being shared, what are reliable information sources, and maybe to think again before this idea of sharing more, of sharing information further before it's sort of verified. And so, yeah, obviously I'm not certain of the specific example you might be talking about, and Danjuma presented great examples from Iraq, but I think it highlights a bigger problem that we're seeing with COVID.
Thank you. I'm seeing a lot of questions now, so thanks everyone for firing away. This one is maybe to encourage more optimistic thinking. Which peace opportunities has COVID-19 brought? And more critically, how are you making sure that when you shift from face-to-face peace committees to digital platforms, how are you making sure that you're not enforcing the same patterns of inclusion and exclusion?
Thank you very much for that question. We also, I think I just mentioned it, I think in passing, about some of the, I'm sure I'm not to use the word positive impact of COVID, but what it has shown is that when communities are impacted, they have the tendencies of coming together to actually support each other. What we see was that, I mentioned this, that there are initiatives by some of the youth groups that we have established, reaching out to each other using digital platforms like WhatsApp to talk to each other because they cannot meet face to face. And we've seen, because when we were establishing these groups, we ensure that in terms of the, we ensure that we maintain, even though it's very difficult, but we ensure that we have female representation, and we also encouraged that they were involved in, especially in terms of the discussion. This youth group has chat groups within their Facebook as well as their WhatsApp pages where they chat and talk to each other. So we feel that it allows them, without the COVID, I don't think that would have been an opportunity for them to share experience. You should understand that this, as we implement this, we're implementing across communities. And so we bring these communities, these youth group together, and then when they went back to their community, they are still reaching out to each other, sharing lessons learned, sharing experience, even though they are not meeting face to face. So we see that as an opportunity for continuous collaboration and engagement, especially with regards to addressing COVID-related misinformation.
And I can just add to that. I think what we're seeing is that COVID presents an opportunity for people to unify around a common threat, work together against a threat that's unclear and there isn't a definite shape. I think it's also encouraged a lot of sort of critical thinking. I think the point you raised about shifting from in-person negotiations and dialogues to digital options, I think there's a lot of unclarity around that, about how effective those digital options can be. And to a certain degree, I don't think they can take the place of in-person communication and collaboration. But what I think we are seeing is a sort of a resurgence on the efforts around localization. And I think that COVID is having such specific impacts and everywhere that it's affecting, that the people who need to lead the responses in any given place are those community members in a place. So I think the localization agenda will become an even stronger part of peace building as an outcome of this. And yeah, I appreciate the optimism.
Thank you. Megan, we have time for one more question, maybe two? One? Okay. So just so you all know, when you upvote, it does go to the top of the priority list. So I'm not cutting any lines here. This is what you all want. So here's a question specifically for Danjuma. You mentioned the similarity of current intercommunal tensions with past situations of outbreak of violence. Can you develop a bit more, please? And are there any particular triggers that could further worsen the situation?
Yes. So just like in 2006, because of the political configuration in Iraq, the tensions was between the two major religious sects, the Shia and the Sunni. And most of the tensions are around perceptions of what each other thinks or what we have said. That was in 2006. As a result of these perceptions, people begin to accuse each other. People begin to stereotype each other, and this continued to grow, and then it led to a violent incident, violent interreligious and interreligious conflict in Iraq. Now, the same trend, the same suspicion because of COVID that cut across ethnic and religious groups, the same trend about accusation and counter-accusation, we are seeing it now. And so our team are saying that what we saw happening in 2006, starting with accusation and counter-accusations, what we saw about fake news, misinformation, stereotyping, conspiracy theories against one another is happening now, especially in communities where you have this religious group living side by side. And so their fear is that if this is not addressed, if this is not checked, this could lead to what had happened in 2006.
Melissa, if I can maybe jump in real quick, because I am aware that we are running short on our time. So those of you who are planning to leave at 5 o'clock, that's obviously your prerogative to do so. I do want to ask our two speakers if you would be willing to stay for maybe 5 or 10 more minutes, given that we have a few questions. I think one thing that we haven't, I'm seeing nodding heads from both, so thank you very much for that generosity with your time. One thing that I think we haven't touched on maybe enough, and I'm seeing kind of reflected in a couple different questions as well, is if you guys could speak specifically to effective measures for countering misinformation. And I think you both touched a little bit on how to work with those who are influential leaders within small groups, how to help work with them so that they can actually be part of a messaging campaign that provides reliable messages, reliable information, and also maybe promotes social cohesion. So are there strategies that you guys can refer to in terms of identifying influencers and leaders within these communities that you could maybe briefly reflect on as a general lesson for everyone?
Okay, so I think I want to give like a concrete example. Currently, what we've been doing, and I think it's really, really working, is the fact that we know that there is mistrust of government. But what we've been doing was to identify influential religious, ethnic, and tribal leaders, as well as women leaders within communities, as well as youth leaders, create a platform for engagement and with government. We are currently working with what we call directorates. So directors of youth and sport and directors of labor and social services are part of the platform we created, where youth, women, religious, tribal, and ethnic leaders come together to discuss the impact of COVID. What information, what real information do they want to take to the communities? So they take questions from their communities to the government and say, this is the question our communities are asking. Can you provide reliable information about it? We take this back. We see this happening. And in fact, we are so gladdened to learn that the government, unlike before, we are willing to give their phone numbers and their contacts for further questions, even if these representatives of the community go back and there are further questions asked, they can reach out to them directly to ask those questions, and they will provide answers to them. We have seen that happen, and I think across programs, if we can provide such platforms, I think it will help to mitigate this kind of misinformation, as well as ensuring that government and communities are working together, and also building social cohesion within communities and government.
Thanks, Danjuma. Oh, Emma, did you want to contribute anything further?
I was just going to say, I don't necessarily need to go into it now, but Mercy Corps has published a response framework for digital drivers of conflict that has some suggestions for concrete examples on how to address disinformation and the spread of misinformation. Those sort of fall under a couple of umbrellas, including activities that detect or make sense of information threats and their associated drivers, as well as their impact. That looks at sort of threat mapping, understanding who the influential information sources or barriers to information are. That can be both online and offline. There's also activities that sort of mitigate the impacts, early warning systems, referral systems, crisis response plans, and addressing and countering, like effective measures for countering that information, including push notifications, civil society, advocacy, et cetera. And then lastly, activities that, again, build resilience, that improve the ability of populations to resist the adverse impacts of the weaponization of information, which include things like digital media literacy training and general awareness raising campaigns on the weaponization of information in social media, as well as offline social cohesion building around either drivers or the different associated threats we see around the weaponization of information. So yeah, the report is called it's called Weaponization of Social Media, and that can be found on our website.
Thanks, Emma. Maybe we can also provide that link on our website. I'll ask it from you, and then people in this webinar can go to the event page and find those resources there as well. Here's a question relevant to the last one, but a little bit more specific. As COVID-19 has wreaked havoc on the economies of countries such as the US or countries in Europe, what are some of the best practices learned in some fragile states and conflict contexts that are now also applicable to the US or some European nations?
That is a great question. I have difficulty thinking about what sort of would be applicable in the US right now. I think one trend, I guess, that I've sort of seen is a focus on internal capacity and solutions and problem solving, but that doesn't sort of promote a nationalistic approach. That's not saying us ahead of others. It's saying we have ingenuity and we can create solutions internally, but not at the expense of other countries. And so that's quite a broad approach, but that's what comes to mind right now.
I think for me, it's really funny now because as we speak now, there have been protests going out in Iraq by people, especially in Suleimania, which is actually relatively peaceful in the Kurdish regional government. People are protesting, saying that the lockdown and curfews are unnecessary. And guess what they did? They point out the protests happening in the US and say, after all, US has higher numbers of deaths, higher number of cases, and yet they are going out to protest, and there's no lockdown, there's nothing, and yet here we are being locked down and not asked to move around. So I think again, because we are living in a global community where information is so fast to grasp, some of these things I think is very important in terms of how does behaviors and attitudes of other countries influence behaviors and attitudes of others, especially fragile settings. If protests are going on in the US and there's nothing happening, I don't think people in Iraq will see it as, because after all they will say they don't have as much the case as they face in the US. So for me, it's rather what influence does the approach in terms of what other countries are doing that has either positive or negative impact on how fragile societies are grappling with this COVID.
Very interesting thought. Thank you. Here's another question, a little bit to understand the scope of spreading disinformation. Is there a demographic scope to spreading of disinformation and how they spread it? For example, is it mainly young people using social media to spread disinformation, or older generations using word of mouth?
All right, so again, example, in Iraq, we have the youth social media savvy. They are very, very, very active on social media, especially WhatsApp, Twitter, not as much as in Twitter, but on WhatsApp as well as Facebook. We also feel that because they are social media savvy, they tend to reach out not only to their peers, but they also, because they are from communities, so they can also reach out to their elderly people in their communities through word of mouth. The same way, community leaders in Iraq, I see that they are also a little bit media savvy, social media savvy, sorry. They use smartphones, they engage in Facebook discussions, they post pictures, they do all sorts of things. So I believe that in terms of demography, it's a thin line that separates youth and the older generation in terms of social media use, as well as influencing. Those people that I see that have more reach and more influence are the religious leaders. One of the things that have been commented in Iraq is how the religious leaders in Iraq are using not only Facebook and WhatsApp, but they are using more of Twitter because they know that people who use Twitter are a little bit more intellectual. And so they tend to use Twitter to influence and get things outside Iraq, while Facebook and WhatsApp are used to just mobilize people within Iraq.
Yeah, I'll just add, that's a great point, Danjuma. It's not only about who and through what, but sort of what are other information sources, and I think about what are the topics that are relevant to different groups. And obviously it'll change by context, but I think with youth, the assumption is, yes, there's a higher connectivity in urban centers, but I think we found that word of mouth can spread just as fast in contexts that have low digital penetration. And sometimes it's even harder to understand the spread and the evolution of language when it is by word of mouth. I think one particularly interesting thing about COVID is thinking about the way the information is utilized and how our responses are informed based on how relevant a particular topic is to a different group. So I think initially, there was a lot of, and there continues to be a lot of concern about COVID and the international community thinking, okay, how do we treat the health implications of COVID, as well as the secondary and now tertiary impacts. I think what we're finding in more and more contexts is that yes, COVID is a threat, but it's not the #1 threat that a lot of communities in fragile contexts already face. And so, I think that again reinforces the idea about two-way communication channels and our role as sort of actors to listen to communities, because, we might be adapting programs to respond to COVID when that's not important. It's about, security. It's about having a justice system. It's about being able to buy food. There's a lot to unpack there.
Thank you. And thanks everyone for asking your questions. We had questions coming from truly all over the world. And so we're very grateful for your participation. We do have 2 questions left, but to be respectful of the panelists' time and everyone else's time and not give anyone any pressure to stay, we're gonna have to save those for a later stage. I will put the question askers in contact with the panelists to make sure that your questions are addressed, but unfortunately we're not gonna have time to address them right now live. Thanks everyone. I'll hand it over to Megan.
Great, thank you very much, Melissa. And to everyone here, I wanna give a special thanks to both Danjuma and to Emma. You guys have given us a lot to think about. There's, I think, a lot still to be unpacked, but really looking at this through the lens of how do we better understand the divisions within communities based on how this is affecting those divisions, how they might be exacerbating those divisions, what are the sources of those divisions, how do we make this not necessarily just about COVID, but about a broader appeal towards and campaign for social cohesion and consistent information, reliable information shared across communities. I think you gave us a lot to think about, so I really appreciate both of you guys for your presentations. And I appreciate the audience who had fantastic questions. As Melissa mentioned, we will be putting you in touch with the speakers, and I want to just go ahead and let everyone know that they will be able to write your questions specifically to either Danjuma or Emma. Their emails are being shared on the screen now. So if you'd like to contact them with a more specific question that you'd like them to answer directly, that's fine. They've given us permission to share that information. With that, I'm gonna go ahead and start our wrap up. Simply to say, if this message or if this meeting has inspired you to kind of come up with an idea of something else that needs to be discussed or some other presentation aspect that you would like to bring to us to make a future webinar, please feel encouraged to come and reach out to us and we can discuss that. We will be having a next webinar on June 16th. It will be with our partners from Search for Common Ground. They will be looking at how the response to COVID-19 has been securitized via extreme policing or authoritarian regimes in states of emergency, and what the response has been specifically in the Horn and Kenya. So that will be happening on June 16th. In addition to that, I'd like to let you all know that there will be a post-event or post-webinar survey. It takes 3 minutes and it really gives us really important feedback to make sure that we are hosting these in a way that you feel are useful to you. So we would love your feedback and we appreciate what you can let us know of how to do better and what we're doing well and what we should continue to do. With that, one more opportunity to say thank you to our panelists, Emma and Danjuma from Mercy Corps. You guys were fantastic. And to the rest of you here in the audience, thank you very, very much for participating. And thanks to Melissa for her excellent Q&A moderation. Thank you all very much, and we'll see you next time.